your quality of life is getting a little better. Smarter Heart University and Dr. Scott on AM 970, The Apple.
Welcome back to your Smarter Heart University. Let's give you the answer to the pop quiz. First, men with erectile dysfunction are 2, 3, or 4 times more likely to have a stroke. And Bob went all out on that one.
Yeah, I did.
Well, men with erectile dysfunction are 3 times more likely to have a stroke. But here's the really important fact. Even after all the big 6 that I talked about in terms of risk factors are taken out of the equation, stroke rate is increased by 150% if you have erectile dysfunction. Whew. Let's talk testosterone. It is well documented that testosterone levels decline, and as testosterone levels decline as we get older, so do the number and quality of erections. Low levels are seen as we get older, as I said, if you're obese or overweight, diabetes, and if you have heart disease. And again, sometimes it's the converse. Sometimes is either a marker of heart disease, or once you have heart disease, do you have more erectile dysfunction? Having a low level has been well shown to increase your risk for cardiovascular events and dying from any cause. So cancers and all of those have been increased with low testosterone levels. It's been in the news a lot lately. Having a low level also correlates with the presence or severity of the blockages in your arteries. That is, the lower the level, the greater the plaque. Think about it. Logically, men have a higher cardiovascular risk than women. Why? Well, the various male sex hormones therefore have to play a role in the development of disease. So having a low testosterone level also may inhibit the effectiveness of taking one of the ED drugs. And there's no evidence that replacing testosterone increases your cardiac risks. Right now, there's currently no evidence of that. All of this that I've just said is currently lacking in terms of the awareness in the medical community, even we cardiologists, that's for sure. Everything stated here gives us a compelling reason to screen men at low risk for testosterone, at risk for low testosterone levels, especially ones who fail to respond to the PDE5 inhibitors, the ED drugs. Nonetheless, currently, there is no current guidelines for routine screening for low testosterone. So that's our take on low testosterone. We're going to incorporate that in our what should you do section. So how do we screen for erectile dysfunction? And once we find it, for the rest of the show, what do we do? That's what we're going to talk about. Fortunately, we have the Princeton Consensus Guidelines. They found that simply having erectile dysfunction independently predicts heart disease at a rate similar to that seen in smokers, patients with a strong family history, or patients with high cholesterol. End of story, folks. From this, they stated that erectile dysfunction should therefore be considered a coronary equivalent. Like 9 years ago, we were told diabetes was a coronary risk equivalent, and all men with erectile dysfunction should have their risk status assessed. That is, are you low, are you medium, are you high for heart disease? Specifically, and this is their recommendations, men 25 or older should be screened. Why so young? Their findings showed that 40% of men will actually be at an intermediate risk for heart disease. So that was a pretty good, they started in 1999 just to assess the effectiveness of these of the ED drugs, and then in 2009, 10 years later, they said, we need to screen more and we need to establish a diagnosis better. To establish whether or not you truly have ED, there is the Sexual Health Inventory for Men, or the SHIM test. We're going to give this to you the next section, a simple 5-minute test. If you test positive, it is recommended, or test high, it's recommended that you undergo an exercise stress testing or further testing to determine if you're low, medium, or high risk. And this establishes your exercise tolerance and the presence of what we call subclinical heart disease. This is Bob's favorite word. This is basically, what this means in English is that which produces no symptoms but is there nonetheless and could be fatal. Low risk is that you walk for greater than 4 minutes on a treadmill, your blood pressure is normal, you have no symptoms, your electrocardiogram is normal, or you have normal images on a nuclear stress test or CAT scans of the heart, as we'll talk about. Intermediate is any of the above seen in less than 4 minutes. And what what has been shown is there's a decreased exercise duration been observed with men that have ED before anything else. So again, that little smaller penile arteries collect, but it also is kind of, again, the tip of the iceberg, to go back to my introduction. If you're low risk, sexual activity can be initiated, or it can be resumed if you are already into it. Intermediate risk, you got to establish the cardiovascular risk status. Blood pressure, blood sugar, cholesterol measurements. Why is this so important? Well, 50% of asymptomatic men with erectile dysfunction between 40 and 60 years old will have an abnormal stress test. And this is what the Princeton consensus found. Worse, 20% will have an abnormal cardiac cath, a coronary angiogram with heart disease, folks. It's pretty scary stuff. Once you've been determined, if you really truly are, it could reclassify you. In other words, you could be at higher risk or you could be lower risk. That's important. So again, consider yourself intermediate if you have at least 3 of the big 6 risk factors that we talked about: diabetes, high blood pressure, smoking, no exercise, etc. High risk people, well, it's pretty obvious, but to be stated. But if you have a cardiac condition or symptoms, you got to stabilize those first. So just for your own edification, uncontrolled high blood pressure, heart failure, a recent heart attack or bypass surgery, moderate to severe valve disease, or high-risk rhythm problems, all would be considered high risk. So the take-home point is this: there is no evidence that treating the erectile dysfunction or resuming sexual activity once you've been diagnosed with heart disease or a risk for heart disease will further increase your risk if, and this is the big if, you have been properly assessed, treated, and counseled. The PDE5 inhibitors, the 3 drugs that we talked about, have an 80% success rate in heart disease patients and a 60% success rate in diabetics or diabetics with heart disease, with no excess risk of a heart attack, stroke, or death from taking them. And that's a big take-home point that I hope everybody out there understands. That's a lot of information to throw at everybody, but it was really important we get it out there because we're concerned just as much as everybody out there is.
It is, and I think there's a couple things we're worried about or talking about here. First is recognizing, gentlemen, that if you're having a problem before you have any other disease, if this is the only thing that you have going on, you need to bring it to the attention of your doctor. And as physicians, we need to be asking this as part of our general assessment of patients, because it's a problem that has effective treatments that are safe. So we can address this problem. Also, it's an indication of the thing that is going to kill you, the heart attack. So there's 2 components. There's the problem itself that we can treat effectively and safely, but there's also the issue that this may re-stratify or put you into a much higher risk of heart disease,
right?
And that's important as well. If you could come to your doctor and say, doc, I'm having a little hard time getting an erection here, and that doctor addresses that and says, you know what? This is just as we said, this is just the tip of the iceberg. You really have some other problems that we need to address. That we'll deal with the erections as well. But you're coming here. It says, you got some problems that we got to deal with in your heart. We get that sorted out. Now you've maybe just saved your life as opposed to just saved your sex life.
Well, so those that are listening, and hopefully those that will listen at some point when we post this in 2 days, the important point is that most people ignore symptoms that aren't necessarily affecting them too much. We talk about this in our cholesterol and our diet shows. Why bother necessarily seeking out more medical attention if I can just take a pill? But in this case, folks, it's actually important to seek out medical attention. I think this kind of separates the wheat from the chaff, so to speak. This really it should be more questioned at every history, at every physical. I try almost every evaluation to ask that question. It's amazing if you just ask what you get back, because again, we're all stressed out. The world's a different place. It gets worse for a lot of people out there. Stress, is a major emotional factor that can cause erectile dysfunction. Okay, so what is What is organic? What is nature versus nurture? What is, what's environmental or what is structural? That's the best way I could put it. What's above it? What's in your brain and what's in your body? Right. And we have to. Your doctor has to separate that out, but you have to get to your doctor and tell them in the first place. That's the point.
And you don't have to be going to your doctor for some other reason. You can make this appointment to see your doctor
Just
and
like
say,
a commercial.
Yeah, this patients come to us for other reasons a lot, but you can make an appointment with your doctor or make an appointment with a cardiologist or urologist and just to ask this question. Say, doc, I'm having a hard time getting an erection here. Can we do something about this? And hope in your doctors, when you're seeing the male patients, make this as part of your general.
That's right. We hope doctors are listening to this too. We hope physicians always will get some information, just like we learn producing this for all of you. Bob, any comment about how high the stress test abnormalities would be? Because you're the guy. I mean, that's your specialty.
It's news to me. It certainly goes along with the fact that this is a systemic disease and manifesting itself into the which comes first? So you're going to have problems with erection. You're going to have problems with your legs.
Yeah. Let's get a pop quiz.
To the heart.
Let's get a pop quiz. A man with moderate to severe erectile dysfunction has a 5% chance of heart disease in 10 years if he's 30 years old. What percent, 20, 30, or 40% does he have at 60 to 69 years of age?
I'd say, what is it, 30%?
Are you going to say 20, 30, or 40?
30, we'll say this time.
30%. All right, we'll be back with your answer on Smarter Heart University.
More
AM
Dr. Scott
970.
and Smarter Heart University is on the way.